Hello, everyone. Happy Thursday. I am admitting everybody right now. There's a huge list that we're entering in. So once I get everybody admitted, we can get started. So it looks like a few more. All right. I think we're good to go. And I will update the waiting room, whoever is coming in, if we have some stragglers, and we'll just get started, if that's okay. Lisa, you're ready to go?
All set, let's do it.
All right. So thank you for everybody that is joining us today. I think this is our, I don't know, fourth or fifth presentation that we've done on the paid family and medical leave program that is starting in 2026. There have been a lot of changes. We did this earlier this year to kind of give everybody a warning and what's to come. And so we're really happy to and excited to present the final version. And Lisa is so good at giving this information that all of the changes within the law, and as a dental practice owner, just at the end of the day, it's like, what am I supposed to be doing in my practice? Like, give me a punch list. I need a little bit of the why behind it and what am I supposed to be doing? So Lisa is going to be starting with that portion. And then for whatever time is left, we've done this presentation several times. Sometimes we have 2 hours. Sometimes we have 45 minutes and we get it done either way. So at the end, I hope to give you some pearls and things of that nature to help with how to survive and thrive with short-term team members should you have an individual that's out. Lisa will go ahead and introduce herself. I see a lot of familiar faces on the registration, but for those of you who I haven't met before, I'm Shannon Snell. I own two businesses that serve private practice dental offices. One is a recruiting company and one is a dental consulting company. But a little bit more interesting fact about me is I used to be a temporary dental hygienist, and that's kind of how I started in this career. I worked in over 45 different practices. I was also a practice manager and dealt with how to bring somebody into the office, make them feel comfortable, make it be a successful transition. And then I also owned one of the largest staffing agencies. So I have all of the hats on what it looks like to be a temporary employee that's in a practice that they're not a part of, full time, running the agency, and then also managing that space. So with that, I will come in towards the end, but Lisa's going to get started with all of the spicy details about these employment law changes.
Thank you, Shannon. Yes, they are spicy indeed, and they're getting a little spicier as time goes on. Hi, everybody. My name is Lisa Netzer. I'm an attorney with True North Practice Transitions, and we're a law firm that helps dentists buy and sell dental practices. We also do contracting and other work regularly with all sorts of dental practices. And I come to the office with a background in employment law. When I first started working with this space in 2019, we really were focused on all the differences between small employers and large employers. And now a lot of the laws that used to apply just to large employers now apply to everybody. And this is a good example of that. So we're going to jump in. Erin, if you want to go ahead and advance, what I'm going to talk about today is your responsibility as an employer to administer Minnesota paid leave in your office. There might be people who are part of this group who are here as employees. They're going to be the people affected by Minnesota paid leave. I just want to let you know that my lens today is that from the employer's point of view. And so if you are someone who's listening to this for other purposes, please check out the Minnesota paid leave website. They have frequently asked questions and other information. It's really important to make sure you get your questions answered as well. We are going to talk about employee policy updates, things that need to go in your employee handbook, especially towards the end of my presentation. We are going to talk about the things that are in the nitty gritty, but it's super important. So we'll get there. And also we're going to leave with you with a to-do list for 25 and 26. All right. Before I go any further, I'm sitting here holding a note to remind myself that if you have questions, please leave them in the chat. While Shannon is working through her material, I'll look at some of the questions and we're going to answer a few of them. We know some people really have to, have a hard stop at 1 o'clock for patients. Don't worry about it. We will make sure though that I stick around and Shannon will stick around to answer questions. So please, anything that comes up for you during the presentation, put it in the chat and then you will address questions at the end. All right. Whenever we talk about Minnesota paid leave, it always helps to step back just a little bit and look at paid leave in a bigger, broader context. And one of the most important things to understand is that the United States remains the only industrialized nation not to have government benefits for people who, one, have a child, or two, have a medical condition. We don't provide universal health care. We don't provide subsidized health care. It's just a very different animal compared to other advanced economies. And instead, since the 1930s, the United States has said, hey, employers, you're going to provide these benefits or you're going to administer these systems. So we take Social Security taxes out of people's paychecks. We take Medicare contributions out of people's paychecks. And that is just, you know, a growing thing that has been happening for a long time. Way back in 1990s, the federal government passed a law called the Federal Family Medical Leave Act, or FMLA. And I am so sorry, but I'm going to make you learn a little bit of legal jargon today. And that is that FMLA is kind of the basis upon which all paid leave programs are based. But it is a federal law that applies to employers with 50 or more employees. Therefore, smaller employers have no experience with FMLA. And we're going to talk about that. It's going to come up several times. So FMLA, the Federal Family Medical Leave Act, we're going to talk about that. When it was passed in the 90s, people always intended it to become a paid leave program, but it never did. So states have stepped in and decided to make paid leave benefits available for employees. 10 states already have, 4 more states are joining next year, including Minnesota. And 12 states have a variety of programs. Some of them are voluntary programs, some of them are for large employers, some of them are for state governments. But in over half the states, there's some form of paid leave benefits going on. So just know that we're not jumping into uncharted territory here. We are going to be joining more than half the states in the country with paid leave. Now this slide gives you kind of the very short and easy version of Minnesota paid leave. But I want to talk about from the perspective of which employees are included. And the important part here is that Minnesota paid leave is built on the back of Minnesota unemployment. So, but as a business owner, you have the option of deciding whether you want to take unemployment benefits or not. With Minnesota paid leave, you don't have that option. But both systems take information from your office about your quarterly employee wages that were paid out. And so rather than build a whole new system, we're going to still take that system and put that information into the system that's going to feed both departments. What's important to know about this, though, is if you are a business owner and you've not taken unemployment benefits, you do have to make sure that you're listed as an employee for the purposes of Minnesota paid leave. Why? Most business owners are paid through both a W-2 and a K-1. And if you are receiving a W-2, you need to pay employment taxes on that W-2 amount. It has the same limitations as Social Security or other taxes. It's only the first $176,000 that you pay those employment taxes on, but please work with your accountant if you think that you might not have been listed as an employee in the past because for unemployment purposes you didn't need to. Make sure your registration with Minnesota paid leave is accurate and it shows that you are an employee if you receive a W-2 for part of your wages or payments. All right. Sometimes it's also easier to talk about Minnesota paid leave not in isolation because it does interact with other paid leave laws. And we've just recently, in the last 3 years, run into Minnesota Parental Leave Act, which in 2022 was amended to apply to all employers within the state of Minnesota. So we now know that hopefully your handbooks are updated to say that employees get 12 weeks of unpaid leave for the birth or adoption of a child. That's great, but it's not going away. So do you have 12 weeks under the Minnesota Parental Leave Act or 12 weeks under Minnesota paid leave? Well, you can write your handbook to make sure that for the most part, those two leaves are stacked on top of each other. They're going to run at the same time. The magic language we use in employment law is that the two leaves run concurrently. They run together. They both run, those 12 weeks run out at the same time. And you just want to make sure that language is in your handbook if you haven't done that. We're also not going to leave behind the earn sick and safe leave from a couple of years ago. We will talk about that a little bit in this program, but just understand that earn sick and safe leave was always meant to be for short-term illnesses, and Minnesota paid leave is for long-term, more serious situations. So they are not the same system, they are separate, and your handbook should address both of them. Finally, there's that FMLA, that federal law. It is the one that says we're gonna have 50, if you have 50 or more employees, you have to abide by this. If you have a handbook that elects FMLA language in it without having 50 employees, please consider updating your handbook, especially now that we have Minnesota paid leave. And if you are subject to FMLA, you're going to have another layer of editing because you have to have Minnesota paid leave provisions and FMLA provisions. They have to work together. So it's really important, again, to update based on those statutes. All right. We're going to spend quite a bit of time on this particular slide because this is Minnesota paid leave in a nutshell. I wish I had been able to come up with a graphic that would work, that would talk about one bucket of medical leave and one bucket of family leave, because that's what employees will have. They'll have 12 weeks for their own medical condition. That's a medical condition affecting that employee directly, or family leave. And the family leave is broken down into bonding, caring, safety, and military active duty. I want to just take a second on the military active duty because this is a little bit different than what we've had in the past. Most of you know, if you have an employee in your practice who is in the National Guard or in some other way serves the military, that they are allowed benefits under a program called ERISA. It is a federal law, and it helps them be paid while they're on active duty. This change is not about those employees. This change is about the family members of those employees. So let's say you have someone in your office and she is married to someone who is in the National Guard. Then when that person is deployed, or if they're deployed, that employee would be able to take some family leave time to cover some of the family duties that aren't covered because their spouse was deployed. So it's about family leave. It's about taking care of the family members. And again, it's a up to 12 weeks for either bucket, but you can't cross buckets. What am I talking about? How does that even work? Well, if you are let's take a very common scenario, a person who is pregnant, and in the last couple of months of your pregnancy, you get placed on bed rest. Well, that might be 8 weeks of medical leave based on your own medical condition. And then when the baby's born, you can take 12 weeks of bonding time. In that situation, you add up to 20 weeks, which is the maximum you can take out in any 1 year with the Minnesota paid leave program. So that's an example of what would work. But let's say you have an employee who has taken 12 weeks of bonding time, and then a parent has a stroke or some other condition that leaves them in the hospital. If you've already used up your 12 weeks in one bucket, you don't get additional time or additional benefits. So it's up to 12 weeks, depending on the bucket, and they could be combined up to a maximum of 20, but you have to meet the circumstances and get approval for those. Now, don't worry, you don't have to approve any of this. Minnesota paid leave will approve or disapprove an application by an employee for that. And one other detail on this slide is super important. Notice I have up to 12 weeks or 480 hours. Why would I write that? Under FMLA, employees are able to take time that is spread out and has different schedules or different parts to it. And that makes a lot of sense when you have something like a cancer diagnosis. Most cancer diagnoses involve some form of surgery, radiation, and chemotherapy. And so someone might be out for different periods of time, have recovery periods in between, and then be out for additional time. So that's what intermittent leave looks like. So we talk about 12 weeks or whole weeks, but at the end, it's 480 hours per year. So let's talk about what a year means. That's on the next slide. When someone takes leave, they can use up to a maximum amount within 1 year. And that year begins on the first day the employee takes leave. So get calendar years out of your heads. You basically set a calendar based on the first day that someone uses the leave. So you're always going to have 12 months going forward from that first date. And that's what a year is, and that's how it's defined. Let's go to the next slide and talk about job protections. Minnesota paid leave makes the teeth of it is really that employees are able to come back to their same job, their same pay, and their same schedule. Now, I think most people get the job and the pay part, but the schedule might be hard. Let's face it, if you've had an employee be gone for a while and people are switching up their roles or helping to cover, you might find that someone else does a great job at that, and maybe you wanted to offer them the job instead, or offer them that schedule, maybe move them up to full time or something like that. Unfortunately, you cannot do that. The employee has the right to come back to the same schedule, which in dental offices, let's face it, there's a lot of pressure about who's on what schedule, who's full time, who's part time. You can't mess with that when someone's returning from paid leave. All right. One more very quick thing. And in fact, for most of you, this won't apply, but I need to touch on it. So if you are a place that has one location and is located in the state of Minnesota, you can turn off your brain for one slide. The rest of you stay with me because you might have employees who live in different states and cross the border to come into your practice in Minnesota. Or you might have multiple locations, some across state borders. It doesn't happen to a lot of people, but we have a few that might apply to. If an employee is living in Minnesota and working at least 50% of the time in Minnesota, then that employee is covered by Minnesota paid leave. If you have someone who is living outside of Minnesota and they work less than 50% of their time in Minnesota, they are not covered. So you might have employees who are or aren't covered. Here's an example. If you had an employee who works 4 days a week and the employee lives in North Dakota, but travels to Minnesota to work in a dental practice, let's say this person does invoicing and billing for a practice, as long as they're traveling 4 days a week, they're working 100% of their time in Minnesota, that person is definitely covered by paid leave provisions. But if that person were to decide to do 2 days a week in North Dakota, working from home, and 2 days a week in Minnesota, because they're not a Minnesota resident, they would lose paid leave. So hopefully that's a good example. I won't belabor the point because I know it doesn't apply to too many people. All right. So I'm already 18 minutes in, and I've been throwing around a bunch of terms that I haven't defined. And as an attorney, we hate that. We always like to have things defined. I want to put up here, first of all, this is not meant to be the exact definition of what a serious medical condition is. This is my shortened version of it. And keep in mind too, the Minnesota Paid Leave Administration is going to decide if someone has a serious medical condition or not you. So don't worry too much about this, but to understand this, to help your employees, it is important to know that a serious medical condition means something in which someone is either inpatient in the hospital, in a transitional care unit, in a rehab facility, in a treatment facility. Anytime someone is in inpatient care, they're automatically having a serious medical condition. But it can also be defined by incapacity to work. So, and of course we need to do that. Anyone who's had a surgery or a family member who's had surgery recently, you probably were shocked by how quickly the hospital moved that person straight out of the hospital and to home or to a transitional care unit. I know I've had that experience. So just because you're not in the hospital doesn't mean you're ready to return to work. So incapacity for 7 days or more following a serious medical condition or surgery or other things like that. Any incapacity due to pregnancy is considered a serious medical condition. And then incapacity due to a chronic health condition is probably going to be the next most common thing. So we're going to go to the next slide, because what the heck is a chronic health condition? As I mentioned, back in the 1990s, Congress passed the the Family Medical Leave Act, the FMLA. And there was literally a list of what qualified for leave, the list of conditions. And anytime they tried to update or change that list, of course, all mayhem broke out and it was a huge problem. So instead of doing that, instead we tried to describe it, and this slide gives you the definition of how they're describing a chronic health condition. I think a good example of that is myself. I'm a type 1 diabetic, have been since age 12. And for me, I have type 1 diabetes. That is generally considered a chronic health condition. But right now, all I need to do is visit the doctor twice a year. I am not incapacitated due to my condition. So I do not have a serious medical condition that I would take Minnesota paid leave time for those 2 days I have doctor's appointments every year. But that could change. Let's say years from now, my health condition changes and I need to have a pancreas transplant. Then suddenly my chronic health condition would lead to my incapacity to work or my incapacity following surgery. And then I would have leave under Minnesota paid leave. So things can change. Also think of something like mental health situations such as depression. Someone generally can control their depression well with therapy and with medication, but sometimes those medications become ineffective. You might have someone who suddenly needs more help or support for a period of time. Again, they always have the chronic health condition, but it's when they become incapacitated because of it. That's when it becomes eligible for leave. All right. They got chronic health condition. Family members. For those of you who have worked really hard on your employee handbooks and kept them up to date, you know that we just went through a major change in who is a family member under the Earned Sick and Safe Leave statutes. And wouldn't it be nice if they had said, that's a really good definition of family member. That's what we're going to use for Minnesota paid leave. Too bad. No, we don't get to do that. We have a different definition here. And again, who qualifies as a family member is going to be subject to the interpretation of Minnesota paid leave and them approving benefits. You don't have to decide this, but just so you know, the family member definition is different under Minnesota paid leave and under Earned Sick and Safe Leave. So don't assume one definition is going to apply to both statutes. All right. And finally, bonding leave. I know you know what bonding leave is, but I want you to think about bonding leave in kind of a new way. And the first way that is going to affect more people is the idea of parents taking intermittent leave. Remember, we talked about how it was 12 weeks unpaid with Minnesota Parental Act. And now we have 480 hours of intermittent leave available. That means parent one might take 12 weeks off to be at home with the baby following the baby's birth. But then after that, you might have parent two decide to take intermittent leave so that you only have to pay for part-time for daycare, or maybe they can work with a family member to get coverage, because let's face it, infant childcare is super expensive. So we might see some interesting uses of bonding leave going forward under this new statute. The other interesting development is that for those people who have taken leave in 2025 because of a new child or an adopted child, they are eligible to take bonding leave as long as it's within 1 year of the child being born or adopted. What does that mean for you? Well, you could possibly have an employee have a baby on October 1, take 3 months or their 12 weeks of unpaid leave under the Minnesota Parental Leave Act, and then take 12 more weeks under the Minnesota paid leave provisions, because they're not eligible to take the paid leave part until January 1, 2026. So this is the time, this is the one time that if you say things are going to go concurrently, that it doesn't actually apply, because people don't have the right to take Minnesota paid leave until January 1, 2026. Let me tell you, this is probably one of the most controversial things about this new statute, but it is very clear on their website right now that if you are a parent and you had a child in 2025, you are still eligible for bonding leave within 1 year. Like I said, if it's October 1, someone could take, basically 24 weeks straight. If you had a child, say February 1 of 2025, you could only take 4 weeks, because then you'd be within, you'd hit the date of the child's birth. within 1 year. So, but yeah, people might reach back and try to do that. They might not. Keep in mind, this is all Minnesota paid leave does not replace 100% of someone's wages. It replaces a percentage. So there's still a strong incentive to get to work and to get paid 100% of your wage. But I'm not going to say that people won't do this or won't take advantage of it. And as I said, it's very clear on their website right now that this is going to happen. All right. Notice of leave. This is some of the gritty detail of what your employee handbook needs to talk about. The first top 3 bullet points are things that should be in your handbook, and make sure you don't have other provisions that contradict them. And the last 2 are about documentation that you can get and can request. So the first thing to know is that employees only need to provide 30 days notice of their intent to take leave. A lot of policies I know out there, we ask for leave as soon as practical, or 60 days, or something else. Here it is 30 days notice. So please make sure your employee handbook is updated. Also, if you have a requirement that the request be in writing, you cannot enforce that. It can be oral, it can be over the phone, it can be by text. So make sure that you don't trip something up in your handbook by requiring written notice of paid leave. And finally, though, you do have control over who the person needs to talk to. So someone texting their friend and saying, I'm going to take leave is not notice. You can require that they talk to a specific member of your staff or to yourself. So if it's your office manager, your front desk person, the owner, the doctor, their supervisor, however you want to describe the role, that's fine. Just make sure, again, it's in your handbook. Now, there is information that the employee must give to Minnesota paid leave in order to apply for paid leave benefits. And you are able to ask for a copy of that certification. So make sure that that's in your handbook, that you want to make sure you ask consistently for a copy of the application. And then once someone is granted leave, then you will receive from Minnesota paid leave a description of what the person's been approved for, what their schedule looks like, how long they're going to be out on leave based on the information provided. So again, 5 bullet points. Sorry for all the text on the slide, but important points for your employee handbook. Okay. The next thing that you need to do still in 2025 is appoint a paid leave administrator. Hopefully you have someone in your office who already interfaces or regularly is checking in with the Minnesota unemployment system, and they're pretty familiar with it. Like I said, Minnesota paid leave is built on top of the Minnesota unemployment system. So hopefully that person can be the same person who can become your paid leave administrator. But becoming an administrator and having someone apply for leave is not instantaneous. So I'd encourage you in this year before January 1 of 26 to make sure you have that person set up, and be thoughtful about who you're assigning it to, because this person will have information about their fellow employees and we need them to be discreet. So make sure you've got that person appointed and set up before the end of the year. All right. I know that you guys know not to retaliate because we've already talked about job protections, but I want to emphasize again that someone is entitled to come back to the same schedule. If that person comes back from paid leave and they need a part-time schedule, or they want to go up to a full-time schedule that's open while they were gone, or something else that you both agree is in the best interest of the practice, you can move them to a different schedule, but you have to document it. Make sure you document it so it doesn't look like payback or it isn't interpreted that way for coming back from Minnesota paid leave. So please be careful about that. Right. This slide I put together as a completely rough estimate of what employees will get while they're out on paid leave. It is a complicated formula, and it is a formula you don't have to know. If you're an employer, you are not going to calculate what the paid leave benefit is for each employee. Instead, Minnesota paid leave will calculate that. And I want to point out that at the bottom, I've put in a website reference to the employee calculator, so employees can see what it is that they need to, what they'll be getting if they apply for benefits. Now, guess what? It's still set up pretty much as a like Minnesota unemployment, employees are required to put in their first quarter, second quarter, third quarter employee wages, and most employees never think about how much money they make in a quarter or what's that defined as, or things like that. So you might need to help them a little bit with the employee calculator, but that's how they're going to find out how much money they're getting. Basically, most people who make around $20 to $30 an hour are going to get closer to 90 or 80% of their wages replaced. Other people who make more money are going to hit a cap, and that cap is set at 150% of the Minnesota average weekly wage. And if that's a mouthful, it's because it is. And also, it's a changing number. In 2025, 150% of the average weekly wage is $1,370 per week. So if you are making more than that per week, you are never going to get more than $1,370. Those new numbers for the next year will come out in October, November of this year. So that cap will change over time. But really, anytime someone's making more than $1,300 per week, they're going to get less and less of their wage and be closer to just that cap. So I want you to be aware that for some employees, it might be interesting. They think they're going to get all this money, but the truth is they're going to get a percentage or a capped amount from Minnesota paid leave. All right. Now, I know this slide doesn't look super spicy or exciting, but this is probably the most important slide that I've put together about Minnesota paid leave. And I want you to think for a minute about paid time off or vacation or sick leave, whatever you call it in your practice. And I want you to expand your mind about paid time off. When an employee, like I just said, employees are going to hit a cap in how much they can get, or they'll only get up to 90% of their wages. And the assumption is if an employee has paid time off, they could use some of that paid time off to get back up to 100% of their wages. What would that look like? So let's say you have an employee with 2 weeks of PTO and they're going to be gone for 12 weeks for bonding time. The employee could take a portion of a PTO day every day until they run out of that PTO benefit to get back up to 100% of their wages. Now, if all of that sounds like mushmash to you, or because in working with dental offices, I've come to understand that the vast majority of you believe that a PTO day is an 8-hour day. It's a solid block, and that's what it is. You have the option to not allow people to supplement their benefits with PTO. Now, it doesn't mean they can't use PTO, but it turns it into an either or situation. The either or situation is that you can use PTO to cover that 2 weeks the employee had earned and saved up, 2 weeks of PTO, and then 10 weeks of Minnesota paid leave. So they get 100% of their wage for 2 weeks, and they get Minnesota paid benefits for the remaining 10. So if you want to go to that either or system, you need to say in your employee handbook that you do not supplement benefits. You can't use your PTO to supplement benefits. If you don't address this, Minnesota paid leave will assume your employees are allowed to supplement benefits with PTO. Now, one other kicker is that employees are not required to use their PTO. So let's say same employee, they have 2 weeks of PTO, they're going to be gone for 12 weeks. That employee can choose to save the PTO for when they get back. Now, a lot of this has come about because under FMLA, again, going back to that federal statute, people were required to use up their paid benefits while out on FMLA. And what happened is you have a bunch of people coming back from maternity leave, putting kids in daycare, and having zero sick vacation or PTO time. And let's face it, kids get sick. So instead, we're giving employees the option to not use up their PTO while they're on paid leave. Instead, they can have someone they get back. So that's important. And one final note, paid leave, workers' comp, two very separate systems. They're going to remain separate. If someone is out due to a workers' compensation claim, they are not in the Minnesota paid leave realm, and they are separate systems. So those two will not overlap at all. All right. Given all this information, how much are you going to pay into the system? This is a change. If you've seen our trainings from earlier this year, the tax amount was 0.7% of employee wages. And now that amount has changed to 0.88%. But you don't necessarily have to pay all of that. Employers can decide to pay between 50 and 100% of that tax. Or you can share it with your employees. The calculator that is available on the website now for employers will help you see what your premium is going to be and what it looks like to pay 100% versus 50%. And you can look at that and decide how much you're going to pay. It ties into the next slide. Let's go there. Because there is a reduction in premium for small employers. This applies to a lot of dental offices. Most dental offices I know have less than 30 employees. Now, you also have to meet the wage requirement that your average wage is not more than 150% of the state's average annual wage. Again, though, that calculator is going to automatically put in the reduced premium calculations for you. You do not have to enter that separately. If they see you have less than 30 employees, they're going to apply that premium reduction. What's interesting though is the premium, if you go back one more, the premium reduction is only applied to the employer portion of the taxes. So in some cases, if you have a very small office, you might have a very low tax requirement. Say if you have 4 or 5 employees, and you could take it on at 100% because you're going to get that reduced premium for that whole 100%. If you only pay 50%, your employees are still going to pay the full amount that other employees pay on the employee taxes. So you might want to get in there and play with this to decide what you want to do with this. All right, let's go forward. There are small grants available for employees, but I have to be honest, I have not seen any information on this. I'm hoping that as we get closer to January 1, Minnesota Paid Leave will put out more information about the grant funding. I wanted to have more information by the time we got here, but this is largely based on the statute. I'm assuming their website will be updated with more information, so keep an eye out to see if you could qualify for some money to help you offset that employee, the increased costs of hiring temporary employees. All right, your to-do list. In 2025, you have got to update that employee handbook. You're going to have a lot of things to think about how you're going to do this, what you want to do with different decisions about supplemental benefits or not supplemental benefits. You're also going to appoint that paid leave administrator, and then starting December 1, everyone needs to inform their employees about Minnesota paid leave benefits. Minnesota Paid Leave will send out another lovely poster for you to post in your staff area so everyone can see it. And then in 2026, we're on the next slide, we're going to go ahead and get this party started. We'll see what kind of applications we have coming in January of 2026 for paid leave, and payments are due on April 30th. So that's all that I have for you. I know there's a lot. So again, questions in the chat, please. And here's my contact information. We can put that up again later.
But in addition to prepping for these new changes with the paid leave, another goal that you could potentially have would be to start setting up standard operating procedures and what we call SOPs in place. So you can have a happier and more fulfilled team, of course, and healthy patients, but you're also setting yourself up for success when you do have temporary employees in your practice. I remember when I was a temporary employee at one point in time, I could be at a practice that the patients are coming in, loving life, that everybody enjoys working there. Everything just flows very, very smoothly. And everybody's happy. And then the next day I could be at a practice where there's no systems in place, nobody knows what they're doing, which leads to frustrations. And so having those systems in place regardless, and having that be a goal for the end of the year, would be a fantastic goal to have. Good old Google tells me that there's 383 billion different ways that you can order your Starbucks or a coffee. I don't know if you knew that. But when you look at Starbucks and all of those different drink combinations, they rarely mess up. I mean, they do once in a while, right? But rarely, because they have systems in place. So how can we create those within our teams? One example with one of my clients the other day is we created it's very simple. There was comments about, okay, every time I go into a different hygiene room, I get a different delivery, or they don't say anything at all. And my comment was, do they know what to deliver to you and in what order? No. So we made a little checklist for that. Another doctor had a great example of, with the front office, we're really big into writing front office SOPs, or standard operating procedures. How in this practice do we collect or create an estimate, or do treatment planning? What does that look like? And she made a great point. She goes, hey, if you write a SOP on how to check a patient out, I, as a doctor, not knowing anything about the front office, should be able to follow it pretty well with instructions. And then you create somewhat of a clinical playbook, a front office playbook, and it becomes a lot easier when you have temporary or short-term team members in your practice. So where to find coverage? You can advance to the next slide, Erin. You can look, my favorite part is looking internally. Your team members can get super creative. They might be able to piecemeal some coverage together. Maybe people want to pick up extra hours. There might be individuals that are cross-trained. Really letting them be creative and what that plan could look like could give you ideas that you didn't even think about prior. Recruiting agencies such as dental recruiters, one of our companies, can help. What we do is we offload the work that it takes to bring on even a long-term employee, but short-term, but permanent. We can help with recruiting an individual like that, designing an ad, what you should be, offering for compensation and benefits, doing background checks, and even for not short-term, for permanent placement for the future. So there's internal recruiting, which is also a favorite of mine. And what that means is letting your team know, hey, we need help for 20 weeks or 20 weeks times 2, or you could have multiple people out for 20 weeks. Do you know anybody that would be interested in coming to help? I'm going to have somebody that's consistent, not a different person every week from potentially a staffing agency, and give them a bonus for finding somebody for you, because you would be paying a placement fee or paying somebody else to help you with that anyways. So that is an option as well. And then of course there's staffing agencies. There's a lot of great staffing agencies out there that you could ask for coverage and request that you get the same person each day. And that's not always a given either, but also a viable option for this. Now, if you're wondering, okay, what is short-term coverage gonna cost the practice? I don't know if insurance reimbursements have increased all that much when the going rate for a dental hygienist was $30 an hour when I graduated. That was the going rate, is you didn't take less than 30. I don't think reimbursements for insurance have increased that much, but the wages for hygiene have. So when you look at this list, hygiene 52 to 65 plus comp model. A lot of offices are on a comp model, which you have questions about. I can explain at a different time. Dental assistants, front office admin, responsibility varies. You can pretty much increase the wage 60 to 65% what their base is. So for example, if a hygienist is making 52 to 65, they might be charging $90 an hour to be an interim short-term coverage for your practice. And then locum tenens, that can range anywhere from 150 to 180 per hour, depending on what responsibilities they have within your practice. Now, there's opportunity cost of not having coverage. So I remember when I owned the temporary agency, that's all we did. There were several doctors that are like, I'm going to shut down my schedule because I don't want to pay temporary wages. And I get the why behind that, but there's so much opportunity cost. Number one, and especially if it's a hygiene column, your hygiene column funnels your restorative, almost 80 to 90% of it. So you're also missing out on that. You have patients backlogged on recare. So maybe they need to be coming in every 3 months. They can only be seen every 6. There's major capacity issues. There's lots of opportunity costs for not securing coverage. So when you look at that $90 investment per hour and your insurance company only pays you, I don't even know, for a pro fee, don't look at that apples to apples. Look at big picture as you're looking to fill in the gaps for this leave. Now, the big question is when we look at the dental hygiene role specifically, and you can, before you look to see if you need to add coverage, ask yourself, how many hygiene days do I actually need at my practice? And there is a formula. You can screenshot it. You can take a picture. If you have any questions about it, you can email me directly regarding this. But essentially, you take your active patient count, which in the 7-county metro area, we believe it's 18, the last 18 months. So that's a unique patient visit in the last 18 months. Our out of the 7-county metro area, our rural practices, we used a unique visit every 24 months. Due to the demographic, our farming communities, and all of that, that's still a viable patient in our eyes every 24 months. So you do a little formula and you can see how many hygiene hours you need to sustain your active patient count. Now we use that as a starting point. Do you want to grow your perio program? So if you have in the teens perio percentage and you want to grow that, you're going to need more hygiene hours on top of that because your patients that are coming in twice a year are all of a sudden going to be coming in 4 times a year. So your schedule multiplies. If you're in a stage of growth, like our startup clients, they're going to need more hours to create opportunity for that. So those are some ways that you can kind of gauge how many provider hours you're actually going to need. And I know some people have questions. Feel free to put those in the chat. And we'll also save about 5 minutes at the end, as Lisa mentioned, but we can stay longer than 1 if you're available to do that. Assisted hygiene. If you would have asked me when I graduated hygiene school and I started working in private practice and in all of these temporary positions, if I would ever coach on assisted hygiene, I would say barf. Like, who does that? It's not a good model. There's all of these wrong things about assisted hygiene that you could say. I get it. We have a great program that we coach on, but we do it for the sake of if a practice needs it. It could be a rural practice that cannot get a dental hygienist in, but wants to be able to serve as many patients as they can. They might switch to assisted hygiene. This is also a very good opportunity to go to assisted hygiene if you have somebody out for 20 weeks and your hygienists are like, hey, I'll do this for 20 weeks. And we can get through it, but after that, we're going to go back to normal schedules. So if you are booking out more than 3 weeks for periodontal care, so I have a patient, I diagnose periodontal disease, they need non-surgical therapy, I should be able to get them in between 2 and 3 weeks. If I can't, there's a scheduling issue or there's a capacity issue at the practice. Nothing is worse than telling a patient that they have something that is going on and we can't get them in. The second is if you are waiting 2 more weeks for a new patient to get in to receive hygiene care. So if you're in any of those, you might consider assisted hygiene leave or assisted hygiene for that temporary leave at the practice. Now going in, so the next slide is just saying that you can see more patients, but after that, locum tenens. So if you find that your dentist is going to be out on leave, you can ask yourself, do I need to replace that dentist within our practice? We typically start with 1,500 active patients per dental or dentist provider at the practice that works 4 days a week. We start there. So if you have I'm going to give you an example. If you have 3,000 active patients and 1 and 2 doctors and one of them is out, you may need to supplement that. But if you have 2,000 active patients with 2 doctors and one of them is out, you may be able to make that work depending on the length of leave. There's different ways that you can pay a locum tenens doctor, W-2, 1099, all of the locum tenens, which again is a fancy word for a temp dentist. They all have to be credentialed too within the practice if you're a participating provider. And moving on, licensed dental assistant. Are you running we have some clients that run 2 to 4 columns and are running matrix dovetailed schedules with 4 different assistants. If one of them is out, maybe you don't need to, replace that particular individual. But if you're running one column with one assistant and that main assistant is out, you may consider replacing that individual too. So, in addition to that, with front office, I'm going to end it here so we can have some time for questions. Front office, it's really important, again, to have standard operating procedures in place. If you have one person, yes, you're going to need coverage. If you have multiple, maybe you can get by. But as you may or may not know, if you take the entire list of front office duties at a typical dental practice, there's patient-facing tasks that need to get done. Check-in, patient experience, treatment plan presentation, somebody to do in-office scheduling. You need a real live person in there to provide that for them. There's other non-patient facing tasks that you can either delegate to a remote assistant or a virtual assistant or somebody that works outside of the office, or even not at the front desk, but maybe in a different, room within the practice. And that's working delinquent AR, generating your statements and your collections, following up on your insurance claims. There's a lot of companies that you can outsource this to. Again, if you find yourself in a bind that you just need to delegate what doesn't need to actually be done within the practice. And then again, just looking at, okay, what do we need to do on a daily, weekly, monthly basis? And how can we get through this hump of the 20 weeks and focusing on scheduling, collections, claims, all of that, but then maybe putting some of the other tasks that we do that we get around to, like projects per se, on the back burner for that. Staffing coverage preparation. So if we go to the next slide, again, Lisa gave you a great to-do list to wrap everything up. And I know I'm running out of time here. Assessing your actual need, communicating with your patients, your team, getting playbooks in place. Team leads are great to really take the load off of the owner and the practice manager. And then of course, having patience with that. And then in terms of a profitability punch list, and this is something that we elaborated on in a previous discussion, but really monitoring your cancellation failure policy, your collections protocols, getting all of this in line when you are fully staffed and you're operating like a well-oiled machine. And every time everybody comes to the practice every day, you're really making a difference so that it's not going to be as painful, if you will, if you have somebody that's out on leave, if you have everything buttoned up during the days that you're fully staffed. So these are some things that you could consider diving into prior to that. So with that, I know we have some questions in the chat. Lisa, I haven't looked at them yet, so I'll just have you go ahead